Thank you for joining us this morning. I'm David Heurtel in for Elias. Well, it seems we're not done with COVID, or at least COVID is not done with us. We seem to be in the midst of a summer wave. Hospitalizations are up. To tell us more, always a pleasure to be joined by Aaron Derfel. You know him well, great health reporter with the Montreal Gazette. Aaron, thank you for your time this morning.
Good morning, David.
So tell me, what is the situation regarding COVID in Quebec?
Yeah, so, we're creeping up to nearly 700 hospitalizations. That's with COVID and for COVID, the distinction being that some people show up at hospital for another problem and they test positive while they're there. But you do have a rising number of people who test positive while they're in the ER. So this is, for me at least, 4.5 years, nearly 4.5 years after the World Health Organization declared COVID a pandemic. And it was last year that I think it lifted the international, designation that it's a concern. We're still getting these waves, and what strikes me also as because this is initially a respiratory virus, that it's not seasonal. With the cold and flu virus, it's usually in the fall,
right,
and the winter. In this case, it's in the middle of the summer. That to me just shows you just how persistent this virus is, and the fact that it's mutating so fast that vaccine manufacturers are really scrambling to come up with vaccines that will match and protect against the latest, the so-called FLIRT subvariants, KP1 and KP2 and 3 for this fall.
So that number, 700 hospitalizations in Quebec, put that in context for me. What would be reasonable, and what were the old thresholds? Starting at which number are we talking about waves?
Well, on April 20th, we were at, I think, a low of 400, and it's been creeping up, and similar waves are occurring in the United States, especially in Los Angeles, and also in the UK. And what they're finding out, at least in Los Angeles, is that just because people have had COVID in the past doesn't mean that they'll be protected, a third or fourth time, and that just like with the flu, right? And that some people are finding that they fared better, the last time they had COVID, but this time they're finding out that the symptoms are worse. For some people, it doesn't necessarily mean that these new variants are more virulent. It's just that depends on the individual for whatever reason. Some people are reporting that their symptoms are worse, and some of the symptoms are a very persistent cough and a very sore throat, and so that too strikes me as unusual. Again, just because you've had COVID in the past, just because you've been vaccinated in the past, that will afford you some immunity, but it's not a guarantee that you won't get it, or if you do get it, it will be very, very mild for you.
I think the conventional wisdom during the height of the crisis, back in 2020 to 2022, was actually in the summer it would taper off, right?
Exactly.
So this is like counterintuitive to hear that we're having these new strains that actually are ticking up and affecting us during the summer.
That's it, and that's why I wanted to write about it, and then just to look in to what's planned for the fall. The U.S. FDA and there's a National Immunization Committee in Canada. In its latest guidance, which was issued in May, the Canadian authorities, they didn't even, these latest variants didn't even appear on the radar screen. The U.S. FDA, they updated some of their guidance. So Novavax in Canada, they're working with Health Canada. They say that their vaccine will protect against the latest variants. And I just want to also, for your listeners, underscore that this is still, despite the change is it's people in their 80s who are the most susceptible to hospitalization and sadly death. And even there too, during the first pandemic year of 2020, nearly 8,000 Quebecers died from COVID, and this so far this year it's 500. So the death, the death toll has been dropping, but still, when you think about it, 500, it's not an insignificant number.
No, it's not. No, definitely not. And so, as you see the situation and how it's evolving this summer, is there something that you see our health ministry doing or not doing? I mean, how would you rate our government's response to this situation?
Well, the response right now is non-existent, and that's one of the reasons I decided to write about this again. That it's happening in the middle of the summer, and again, and for nearly 4.5 years after the first declared a pandemic. That to me is surprising, and the government is not really focusing on it. I think a lot of people just feel it's been so long. We just want to move past COVID, but COVID doesn't want to move past us, but I don't want to be alarmist because. I was speaking to a healthcare manager who told me that this wave is not nearly as bad as the waves in previous years, even previous summers, times when the healthcare system was truly overwhelmed. But this is also the time when nurses are going on vacation. Yeah. The system is still fragile, so there's a little bit of government apathy and societal apathy. One of the issues that I just can't understand is why we can't make more of an effort to improve indoor ventilation in schools and other buildings because there are a host of respiratory viruses, and if we improve the air quality in buildings, we'll have fewer people reporting to calling in sick.
And it does seem also that the issue of vaccination, I mean, nobody's talking about getting vaccinated anymore. Myself, I mean, I got my 4 during the crisis, but since then I let it go, and I think I'm in the vast majority here. Yes.
A lot of, there's this anti-science movement, vaccine hesitancy, vaccine, I guess, wariness. I think in my case, I got a total of 7 shots. My family, we have 2 children. We've been very, very careful. None of us have tested positive for COVID. I thought I had COVID. I tested myself and tested with various tests. And this was, I don't know how many months ago that was. But I didn't test positive. So that's the other thing. It's hard to get the tests. And people don't want, to get vaccinated, and so, but this virus is still out there. It's circulating, and it keeps mutating. The infamous spike protein. There are more and more of these mutations that are rising all the time. It's like an alphabet soup of variants: KP3, KP2, KP11, LB1. These are the new subvariants.
I feel like saying, if we don't learn from history, we're condemned to repeat it. It seems that there's a bit of that's going on right now.
Well, in what happened was, when you're absolutely right, because when you look at the death toll in the first year of the pandemic, it was nearly 8,000 deaths. Then it dropped, but then in year 2, but in year 3, there was dramatic, rebounding the number of deaths. This occurred, with the arrival of the, Omicron, which has so many different mutations. Yeah. That's that variant. So that's what happens when people lower their guards. Can we call this still a pandemic? It's no longer an international health emergency of concern. That's what the World Health Organization. That's the designation it used. In the annals of medicine, sometimes pandemics have, gone on for many, many years. It's not a fair comparison. It's a completely different issue. But, there was the AIDS pandemic that persisted for decades. Yeah. So, there's still this debate whether this is now endemic or a pandemic. And endemic means it's just in the background. But I think the fact that that you're getting these waves and you're getting these new variants, and some people are getting sick, and also there's this whole issue of long COVID. To me, this is still something to be vigilant about.
Absolutely.
Even if the authorities and the public are fed up and want to move on.
Well, thank you for staying on this very important story. Thank you for your reporting and your time this morning.
My pleasure, David.
Aaron Derfel, health reporter with the Montreal Gazette.